we need to remind ourselves regularly in this that this is, if you like, it's the Third World War. It's not a war against somebody else, it's a war against the virus. And the people who are in the trenches are the frontline medical and nursing and social care staff and all those volunteers and people who are keeping this together. And we have to applaud them, as we will be doing again this Thursday night. But what's really important is that that should not just be a hollow gesture. And we have to hold the government to account in keeping all these good people safe. Because in the end, it's in our own interest as well to do that, because our own well-being and that of our loved ones, particularly the vulnerable ones, depends on them being kept safe. So, you know, we do live in a democracy. Challenge, critique is important. We need to be as constructive as we can in the present situation, because we're all in this together, to coin a phrase, and we need to come out of this in the least worst way that we can. That's what we have to do. I think the government's been under a lot of pressure in the last few days. And the newspapers, for example, that would normally support a Conservative administration have become very critical as well. I think they're concerned that, you know, the delay, the lack of grip has made this worse than it could have been otherwise. And I imagine what we're going to see over the next few days and weeks is the political dimension of this coming to the fore. Certainly after the Labour Party sorted out its leadership at the weekend, one can imagine that there'll be more pressure. And I imagine that the rank and file of the Conservative Party will be very worried that the Conservative Party will be branded with the outcome not being as it should have been if it continues to look bad. So I think this thing of sharing the blame around, pointing the finger at the Chinese again, and I would anticipate that they may well want to reach out to the opposition parties in the near future, so that the blame or the credit for how this is dealt with can be shared out rather than can just land in one spot. We're looking now at about 50,000 deaths globally, nudging 3,000 total in the UK, of which 560 today in the last 24 hours. And actually, there have been 21 in the last 24 hours in Liverpool, which I'll come back to because of the relevance of the Madrid football match. The late Professor of Medical Statistics at the London School of Hygiene and Tropical Medicine used to say, statistics are patients with the tears wiped off. And we have to remind ourselves that behind each of these numbers is a person and a family and friendships and all sorts of things. And the impact is horrendous. But we don't know whether the curve is going to be leveling off in the country as a whole. I doubt it. The Liverpool thing, the 21 in the last 24 hours, it's 23 days after the Madrid-Liverpool game at Anfield. And I said at the time, I didn't think it should be going ahead. I think 23 days would fit in a timeline of people becoming infected around that time, incubating the virus for a week or so, becoming poorly, and then becoming more seriously ill over that second week, and then those that have succumbing in the last few days and appearing in the statistics today. So, you know, that's where we are there. And if we had taken the measures to stop those mass gatherings sooner, the Cheltenham Festival was, again, maybe 250,000 people attending the Cheltenham Festival over that 3 or 4 days period, then that may have prevented that escalation. Something to think about and to perhaps to feel a sense of profound regret that we didn't act sooner. I think it's been a very curious ride for me. I mean, as people will know listening to this, I've been critical. I hope I've been critical in a constructive and helpful way from the outset, because I had a clear idea about what was going on and what needed to happen. there was a time when I was seen as being a kind of mad professor and a maverick and all of that kind of thing. You know, the mad professor in the American films hopefully turns out to be not quite so mad. And, you know, the question time when I was put in my place by the chair of the panel. And then, you know, it seemed that the media dried up for a bit, as though it was getting a bit uncomfortable. And then again this week, as the media have become much more lined up in the same place as I was earlier on, I've been asked to comment a lot more and to write and so on. So I think, you know, I'm comfortable about where we are now. I think we're getting in the right place. The problem is we still have the worst to come, and we must make sure that what happens now going forward is the right thing at the right time. I mean, the government does keep saying, you know, that they've done everything following the science and they've always done the right thing at the right time. I don't think history will bear out doing the right thing at the right time. They have been behind the curve, but I hope that we are now going to be doing the right thing at the right time. The problem now that's coming up, I suppose, is whether the self-spacing and staying at home and so on can stick, which is why one of the reasons why they keep saying it, because that really is dependent. It is dependent on flattening this curve and stretching it out, the sort of things that they've been saying. Because if we do manage to get this R down, the number of cases that each affected person infects in turn, get it down from 3 to 1, then that can make a world of difference. So we've really got to do that. But as I've said before, we haven't just got one epidemic in the country. We've got a series of epidemics in different places, and the geographies are different. And we really need to get the testing data once it does come on stream to be able to understand better the geographies of this, and actually whether there are some parts of the country where you could take your foot off the pedal because they've got very low numbers of cases, and where you could go back to trying to contain it by testing, triaging and quarantining and treating people who are sick, because I think there's some parts of the country where that would still work. I'm confused about this 7 days and you can go back to work, as seems to be the case with the Secretary of State, Matt Hancock, seems to be what Boris Johnson's been saying, although he's not back, and the reports are that he's not completely recovered yet. So we wish him well. We hope he does get over this properly. But, you know, there have been reports that you can remain infectious for up to 37 days. So we've got, again, a range of opinion here. What is the science? The government has kept saying, we're following the science, we're following the science. You might think they should be erring on the side of caution, and certainly sticking by what the WHO is advising in a state of uncertainty. I mean, one of the phrases which I always fall back on in my public health practice from the Victorians' way of operating was to say, in the present state of incomplete knowledge, it might be prudent to do X, Y, or Z, you know, rather than being dogmatic about something you don't know about or taking a line when you really have got quite a lot of uncertainty. The Secretary of State, Matt Hancock, came out all guns blazing from his period off. He's obviously made a good recovery. He looked in good shape. And he really took this whole issue about testing head on with his 5-point plan. I think, you know, he's talking now of really setting themselves a target of 100,000 a day by the end of the month. But that includes the various types of testing, including the antibody testing, as far as I could understand that. This could be seen as a hostage to fortune. He seems very confident that they can do it. They seem to have been developing these robust partnerships with Astra and GlaxoSmithKline and various private companies. So this is all great stuff. It's good stuff. It's just a great shame it wasn't done before. And we'll have to trust him that he's going to deliver on this, because he said he's going to deliver it. So, you know, we have to support this. We have to believe it. We have to give it credence. And we'll wait and see. I think the press conference, again, they've obviously now been given their mantra, which is to stay at home, to protect the NHS, and to save lives. And that's fine. But, you know, protect the NHS, I think it would have more credibility if we weren't still getting these reports in from frontline health workers that they still haven't got access to proper protection, and they need to be protected. And the people who can protect them are the government. So they really need to get that sorted out soon. On oxygen, which is a new issue which seemed to be coming up in the last 24 hours, the medical director, Powis, was confident that they got the supply chain sorted out with the oxygen. So again, we must accept that reassurance and hope it's right, because if the ventilators do come on stream, and we're told there are 8,000 at the moment, there's just 30 more coming by the weekend, which doesn't seem very many when we need thousands more. But if the ventilators do come on stream, then you need oxygen to go with them, or you might as well not have them. So I'm hoping they have got that matched up. And it is interesting that the supply chain issues of the reagents, as well as the PCR machines, and also the swabs, that it seems as though possibly the weakest link in that chain may be the swabs as much as the reagents, but they say they've got that sorted out now. But I think this comparison with Germany is very interesting, because the point that's being made is that Germany has a very good starting point because their industrial base includes very strong diagnostics. And what's happened in this country, certainly in recent decades, is that we've stopped making stuff. And we haven't seemingly been in the same position to upscale on a large scale in the same way that the Germans had. I don't think that's the whole story. I think part of it is that the networks that we have got potentially in place with the chemical industry and the pharmaceutical industry, they're not vibrant networks. And I attribute that to an extent to the over-centralization of public health and the NHS command and control, so that the regions and the local areas are weaker, and the kind of dynamic networks involving the universities, involving the private sector, the laboratories themselves in the hospitals around the country have to an extent been weakened because they've gone in for a philosophy of economies of scale and outsourcing, and that these are things which I think have weakened the reserve that could be drawn on, but also the centralization has meant that there hasn't been the freedom for the more local networks of capacity to be built up. But you know, that will all come out in the wash when we have an inquiry into what's gone on. But we are where we are. We must support what's being announced today. We must hope and pray that it's going to deliver, because we had another 500 plus deaths today. It's similar to yesterday. We don't know whether that's a slight leveling off. I doubt it in the end, because I think what's happening is that we've got these other waves coming through in other parts of the country. And the London one, even if the London one does begin to level off a bit, it'll be followed by more steep rises in other parts of the country. I mean, the news from the field in the National Health Service over the last couple of years has been dire. Most hospitals have been running up big debts because they hadn't been able to keep pace with the aging population. You know, it's normally estimated that the real terms increase in funding for the NHS over and above inflation needs to rise by about 2 or 3% a year just to keep up with the numbers of elderly people and very elderly people. And so the hospitals have been really struggling over the last couple of years. That's what this is about. They've written that off. They were going to have to do something about it at some point. But of course, now is as good a time as any, because they can't be worrying about this if they've got to be struggling to do the finances. It's interesting, I had a report last week that, we're at the end of the financial year when all the NHS organisations have to file their accounts. It's, I think, the 5th of April is the end of the financial year. And they received notice that they're having a very generous extension to get their final accounts in of 2 days. Whereas other parts of the public sector had been given a month or that kind of thing to do their accounts. And some of my colleagues were saying, why can't they just say, let's do your year end at month 11 and file your returns, because you would have had your finances up to date at the end of February, and you could have filed the return then, and they could have done a 13-month catch-up next year. But so the bureaucracy still lives in the NHS that can impede the guys at the front line doing what they need to do. This issue of masks, I think, is a very interesting and potentially important one. The British have been very iffy about masks, over the years. You see Chinese people in London wearing masks, because of the air pollution from the cars and all of that. And people have been pretty rude about the Chinese wearing their masks. And the science, though, seems quite varied on this. And again, we seem to have come down as a nation to say, oh, there's no evidence for it, therefore it's a waste of time. But actually, there seems to be what you might call street evidence from the fact that places where they have adopted large-scale mask wearing seem to have had a better impact than others. And I've just seen this afternoon a video from the Czech Republic, where they've got everybody wearing masks, and they seem to be doing very well in Czech, and they haven't got the spread. I anticipate that the WHO may well change their position on this, and now might start recommending it. And we might all find ourselves wearing masks in the very near future, no doubt very creative masks of all kinds of designs and styles, as long as they serve the function of not enabling you to sneeze virus particles over other people, because that is probably the most important aspect, rather than them necessarily protecting you from somebody else's viral particles. But we will see, and there's a global natural experiment going on between the countries that do wear masks and those that don't wear masks. So let's all celebrate our wonderful NHS and frontline staff and social care this evening, and stay safe, everybody. Do stay home unless you have to go out, and keep up the hygiene, but find time to enjoy yourself. If you've got any questions, leave them below, and hopefully we'll catch up next time. Programs like this are critical in reaching out to people without any prejudice or bias. Open media, alternative media. Join the future of journalism. Join Double Down News on Patreon.